Good morning, Peralta. Lots of people are joining, so we'll kind of wait for another few seconds as people join the session. Thank you for joining this webinar this morning. We're here to talk about benefits for the Peralta community. Before we get going, just to let everybody know, this is a webinar format. There is a Q&A function at the bottom of your screen. As we go today, if you have any questions about what's being discussed, please use the Q&A feature to submit your questions. That allows us to make sure that we capture the question when we can get it answered and then share it out with you after the session today. So let's see, at this point, we are coming up on 100 participants, well, not quite 100 participants. And it is 11:02, so let's get going. I am going to turn it over to Dr. Ron McKinley, our Interim Vice Chancellor of Human Resources and Employee Relations, to kick things off. Over to you, Dr. McKinley.
Thank you very much, Director Johnson. Good morning, everyone. Very happy that you're here. Hopefully you'll enjoy this presentation. We have our benefit consultants, Alliant, that will be here to give us our presentation and to familiarize everyone with what we hope will be a new approach to providing health care benefits for our active members and also our retirees, that we think will be an overall, will provide overall as good or better benefits for everyone and be very healthy for the institution itself. So having said that, I'd like to introduce Tom Sher with Alliant and also Billy Brown with Alliant. And Tom just raised his hand. You might be able to see Billy. And as also, we have a Howard Odembo, our benefits manager. Ronnie Roberts McCain is also with us, our benefits specialist. We also have Kelly Tufo, who's one of our attorneys with Liebert Cassidy Whitmore, who's helping us with a lot of our labor relations and especially with this particular effort. So without any further ado, I'll turn it over to Tom and Alliant, and they will make their presentation.
All right, thanks, Dr. McKinley. Let's go to the cover slide, Billy. And quickly to the agenda. Okay, so to start with, my name's Tom Sher. I've been a benefits consultant for over nearly 40 years now and have worked with public schools, public colleges, cities, counties, University of California, all of whom have represented employees. We understand that in this business, in the public sector, we understand and respect the role that is played by unions in representing all of the folks who work for the district and how the process works between management and labor to come up with where things might go next. Our job as consultants is to try to bring to you the best available alternatives in the marketplace. And when we talk about best, we can't always exactly match what you have in place, but we can offer programs of comparable value. And especially if we can offer something that's as good overall or better, and it is less expensive, that is typically a win both for labor and management. Our goal is to try and get you the best that you can find in the marketplace. We're not going to sit at the bargaining table. We're going to try to give you the facts about what the options represent, how they work, advantages and disadvantages, and make it as clear and straightforward as we can, because we understand that in many instances, we're not able to have 100 folks who work for an employer on a call. We just oftentimes have only the representatives of the union. And we understand that for all of you on the call, you're going to talk to somebody about what you heard today. And we want to try and give you an understanding of what's being proposed so that you can effectively represent to your peers and colleagues and coworkers what we're talking about changing and how that might be to your advantage. So our outline, by the way, I'm based in San Francisco, lived in the Bay Area the whole time, work with other community colleges and cities and counties. So that's all I do is public sector. We have an executive summary. We're going to talk to you about something called SISC, which is Self-Insured Schools of California. It's a big purchasing cooperative of public schools. We're going to give you the line item detail of the alternative proposals as well as the cost. And we have an appendix which has a lot more line by line information. This is as much as we can possibly put together in as much detail as we can do it. And I hope there's a lot of data on these slides. Please be brave and hang in there with us as we go through it. Next slide, please. What's happened here is that the health benefit marketplace has changed over the last 10 or 15 years. And it's now possible for us to do things for Peralta College that we couldn't have come up with 15 years ago. Medicare Advantage is one of those big things, and purchasing cooperatives is another big thing. Alliant has worked with the district since 2015, and I've had the opportunity to meet your retiree representatives, had an opportunity to meet some of your union representatives in previous meetings, all before COVID. And based on what we know about what's important to both labor and management, we've come up with some alternative plans for your consideration. What we are talking to you about today has been successfully implemented for both active and retired employees by other California community colleges and other K-12 public schools in the state of California. Next slide. When we set out on looking for alternatives, we had some criteria that anything new that we bring you had to meet. First, we wanted to have benefits that are wherever possible as good or better, and that are at the very least comparable in value. We're not going to be able to match every copay exactly. Some will be a little bit higher, some will be a little bit lower. What we are bringing to you today is what we believe is coverage of comparable or better value than what you have today. We wanted to preserve relationships with healthcare providers. Otherwise, the first question anybody ever asks us when we're going to change is, will I still be able to see my doctor? And the answer is yes. We were looking for plans that cost at least the same and hopefully less than Enforce. We looked for something that had a history of modest rate changes. And finally, we wanted to have someone that have alternatives that you could make phone calls to your peers at other universities, other colleges, and find out what they think about it. And we've been able to do that. Next slide, please. Just so you understand the level of consideration that went into this, we're going to show you 2 or 3 slides that were the basis of our consideration. We wanted to be really clear with anybody looking at providing a different vendor providing coverage to you, that they understood the status quo and they understood how much each member, everybody who, and when I say member, I mean employee in this instance, each employee of the district paid for which plans. So these are the current employee contributions. We did make it clear by bargaining unit so that we want you to know that we're looking very specifically at the terms of coverage for every bargaining unit. And we also looked at what goes on for retirees, both in Medicare and what we call non-Medicare retirees, people who are either after 65 and don't have Medicare, there are very few of you left, or people who are before 65 and are not eligible for Medicare yet. Next slide, please. What we also took into consideration, and there are 2 slides coming up here, of who has what for retiree benefits based on retiree date. We know that retiree benefits are a big deal. They're very, very important for the retiree. They are also important for the district because they represent a commitment and they are expensive. And we wanted to make sure that we captured every single aspect of who has what, depending on when they retired, so that we could make a line-by-line comparison. So this slide has that information, and so the next slide has some more of that for different retirement dates. We're not going to spend a lot of time here. We just wanted to reassure you that we documented all that. What's the status quo? The district currently covers 1,650 active and retired employees. 60% of those folks are in Kaiser, 40% Anthem. Of the 1,650, we have 590 Medicare members. And in this 590, we count both the employee and the dependent. Because when you get Medicare coverage, everybody has individual coverage with the federal government, and then coverage under the district plans are also individual. Even though it is a group benefit plan, we treat people as individuals when they have Medicare. If we did nothing, if we were to change nothing and anything we propose doesn't pass, then in July, we're looking at about a 4.6% rate increase, lower left-hand side of the page, for the Anthem plan. For Kaiser, about 4.9. And for Kaiser Medicare retirees, a little more than 5% decrease. Next slide, please. So what are we talking about doing? This is for actives and retirees not on Medicare. The middle column is what's currently in force. Anthem PPO, a Kaiser HMO for actives and retirees not on Medicare, and the Medicare retirees is also Anthem and Kaiser. What is proposed on the right-hand side, upper right, for actives, still Anthem, only it is under the umbrella of Self-Insured Schools of California. And we'll tell you a lot about Cisc in a little bit. Kaiser, you're now contracting directly with Kaiser for actives. That would be, Kaiser would still be offered direct only this time under the Cisc umbrella. For retirees on Medicare, we're proposing that you consider an Anthem Medicare Advantage PPO instead of an Anthem, traditional PPO. Medicare Advantage now covers over half of the 60 million folks in the United States on Medicare, and it's growing every year. It has lots of positive aspects to it that are not available in a traditional Medicare plan like your retirees have today. In the very bottom row, Kaiser Senior Advantage, which is now a direct contract, would be contracted for through Cisc. Same carriers, different delivery system. Next page, please. What we're considering in terms of when things might change, what we're looking at right now is that the current plans would all renew on July 1st, 2022. The rates will change a little bit. Nothing else would change at all. If the alternatives are considered acceptable, those plans would start on October 1st. Cisc under Anthem, Kaiser under Cisc also, and Anthem Medicare Advantage plan. And those rates are then guaranteed October through Cisc. So the Cisc anniversary date is October 1 instead of the district's current July anniversary date. Anthem Medicare Advantage would start on October 1 of 22, but the rates would be good all the way until January of 2024. The federal government provides funding for Medicare Advantage plans on a calendar year basis, and moving to a calendar year basis has some price advantages for the district with a different anniversary date. Next slide, please. This is the dollar impact were the changes to be made as proposed. The left-hand column is the current cost, and you can see how many people are covered under each one. So far upper left, there's 284 actives and non-Medicare folks on the Anthem plan. There are 380 Medicare retirees on Anthem. Kaiser has 672 actives non-Medicare and 237 Medicare retirees. The next column is the cost of each of those today. This is the fiscal year 21-22 that ends June 30th of this year. That's the estimated cost of coverage in the current year. If we were to renew all of the plans for another year, as is, the middle column called Renewal shows the dollar changes. The top row, costs go up 4.6%, second row is 4.6, Kaiser is 4.9, and the Kaiser Medicare is a minus 5.2. Total cost increase, if nothing changes, is about $744,000. Far right-hand side is if the proposed plans are implemented, the Anthem PPO through SISC would cost 20% less, or $8.7 million instead of $11.6 million. The Medicare retiree plan through Anthem Medicare Advantage would cost 31% less than the current Anthem PPO arrangement. Kaiser and Cisc is still an increase, but it's less of an increase, 4.3 through Cisc than it would be from Kaiser Direct. And finally, the Kaiser Senior Advantage through Cisc is 12% cheaper than is your renewal rate from Kaiser Direct. The overall savings spread between the employees and the district is close to $4 million. Next slide, please. This is a very important slide, provider disruption analysis. What we mean by that are any of your members going to experience a disruption in access to their current doctor if any of these changes go through? Upper left-hand corner, we show you that the actives and early retirees, no disruption. In the middle, Cisc, Kaiser actives, no disruption. Of the 590 retirees of the total 590 retirees, and I think it's about 300 on Kaiser, there are 13 who are covered by Kaiser outside of California. In Kaiser, Georgia, Kaiser, Colorado, and Kaiser Northwest. These folks would be asked to enroll in individual Kaiser plans from each of those Kaiser out-of-state programs. That's because Cisc does not contract with Kaiser outside of California. Bottom left side part of the page, Anthem Medicare Advantage. We're going Anthem to Anthem. There is no change in the provider list and no disruption. Next slide, please. So who is Self-Insured Schools of California? Self-Insured Schools of California started in 1979. It is a public agency itself, Joint Powers Authority. It is not an insurance company. There are more than 400 public schools who participate in Cisc. The staff members of Cisc are employees of the Kern County schools. They are public agency employees, just like you are. Cisc meetings are all subject to Brown Act. They're all public. Their financial statements are transparent. They are not for profit. There's no issue. There's no attempt here to make money, as there is with Anthem and to a lesser degree with Kaiser. This gives their renewal information very early in the year. For an October renewal, they will tell us in February what's going to happen. So there's lots of time for people to get ready. And the last thing is that Cisc focuses on members. There's no politics, there's no profit. Next slide, please. This is a little more about SISC. They're in the last 10 years, they started in 1979, which is now close 32 years ago. In the last 10 years, 180 districts and colleges have joined SISC. There are 457 agencies in 44 counties, so they are statewide. Of the what are called the Bay 10 community colleges, 3 are now participating with SISC: the College of Marin, Laney College, and San Jose Evergreen Community College, which is an Alliant client. SISC has hundreds of thousands of people covered. Their PPO is over 220,000. Their non-Kaiser HMO is 33,000 and Kaiser is 88,000. In the state of California, the only bigger health plans are CalPERS and the Federal Employees Health Benefit Plan. Next slide, please. And we talked about, we wanted to be sure that we knew that we had a stable partner if you make the decision to change to SISC. And we have on this slide on the left-hand side is a recent renewal history for the college, for Peralta College, average of 5.8 over the last 3 years. The SISC renewal history for their PPO, for their non-Kaiser HMO, and for Kaiser is on the right-hand side of the page. And as you can see, the SISC 10-year average rate change is under 5% for PPO, under 5% for HMO, and under 5% for Kaiser. Next slide, please. So how does this kind of stability happen? SISC does not bring anybody into the pool below cost. In other words, they do not buy business. This is not about them growing at the expense of the current members. SISC tries to be very clear about preserving equity and fairness for all of its participating members. Once you're into their program, everybody in a geographic area gets the same renewal range, even if you're new, as those who've been in for a long time. Folks come in and stay because the cost stays down and it's stable. SISC is the only program that has a 5-year history of single-digit renewals on every line of coverage. If you compare CalPERS over the last 5 years, has had many of its plans with rate changes, some as high as over 20%. You don't see that in SISC. Their first goal is stability. Next slide, please. Okay, let's get into the nuts and bolts of what we're doing, what we're proposing in terms of alternatives. We're now going to talk about the Anthem PPO benefits and rates compared to the SISC Anthem PPO and the Kaiser HMO compared to the Kaiser SISC HMO. Next slide. So what we have overall is comparable or better benefits. And the way you'll see what we've done in the benefit comparisons is if the copay is a little lower, it's green or in the proposed plan. If the copay is a little higher, it's red in the proposed plan. So what we have don't have identical matches. We have comparable and equal or better value, we believe, than the in-force plans. No disruption in provider access. And we're going to show you the rate proposals, plan design overviews, and then SISC has a lot of value-added benefits that sit on top of their health plans that offer specific solutions for specific individuals with unique conditions like diabetes and back pain and so forth. Next slide. So we've broken this up by bargaining unit. If you look at the header on this page, this is the actives and non-Medicare retirees for Local 39. So we've done this unit by unit to make sure we account for all the different alternatives. And there's lots of numbers on this page and you're looking at it in Zoom. So, oh my God, you know, if I look at Zoom hours and hours a day, and I'm pretty sure you guys don't. So the quickest way to look at this is look at the right-hand side where we've tried to give you a shorthand version where if it's green, that means the proposed plan is better. If it's red, that means the proposed plan is not as good. So if we start upper right-hand corner, there is no deductible in this proposed plan versus $100 or $300 deductible in the current Local 39 PPO plan. The annual out-of-pocket maximum in the current plan is $300 per person, $900 per family. In Cisc, it's $1,000, $3,000. Office visit copay, it's better in Cisc, $10 instead of $15. The very similar lab, X-ray, inpatient, outpatient. We get down to the emergency room. The current benefit is $35 deductible waived, and you don't pay the $35 if you're admitted. The Cisc program is $100. Urgent care, Cisc is 10, so it's green. Current is 15. One pretty important thing that we note here, which we think offsets the annual out-of-pocket maximum above, is that the pharmacy benefit out-of-pocket maximum is much lower under Cisc. It's $1,500 per single, $2,500 per family. And the retail copay is less for generic. It's a little higher for brand at mail order. And this works with Costco. There's a lot of advantages of having Costco as a preferred provider in the pharmacy benefit plan. Next slide, please. So this is now for 1021 and confidential. And as I said, we want to make sure we're covering everybody's benefits. The right-hand column is the same as the previous page. So this is a $10 copay plan, and the current 1021 and confidential benefit is a $15 copay. Everything else is, the Cisc plan is the same as what you saw on the previous page for Local 39. So what's happening is, if you all accept this, 1021, 39, and confidential would all have the identical $10 co-insurance plan. Next slide, please. What are the economics here? What are the rates? This is another one of those horrible slides with 1,000 sets of numbers on it. The one easy way to look is on the lower right-hand corner. Cisc is offering to guarantee rates, and what we're looking at on an annualized basis is a savings for just 39, 1021, and confidential of around $429,000. This happens, there's a slightly different allocation of rates among single, two-party, and family, but there is overall savings between the district and employees. This is the kind of thing that you'll have to look at on your own when you see it. Looking at this and getting an understanding of it in a Zoom presentation when we only have a little bit of time is pretty tough. So you'll get to see this later. Next slide, please. So this is now we're getting into 39, 1021, and confidential for Kaiser. And the left-hand side of the page is the current benefit. It's a Kaiser $15 copay. The Cisc right-hand side of the page is also a $15 copay. There are a few differences, and once again, let me call your attention to the red and the green. So the red, when we get the first thing we see that's different is that the ER copay now is $35. With Kaiser under Cisc, it would be $100. One positive advantage is if you look at chiropractic care down middle of the page, just above the blue line that says vision, is today not covered under your Kaiser plan. It would be covered with a $10 copay up to 30 visits. Vision coverage is very slightly different. The allowance from Kaiser for hardware is $150 under Cisc versus $175 under your current plan. The pharmacy copays under Kaiser are lower, $5 for retail versus 10 today, and $10 for mail order brand, generic versus 20 today. So this is the kind of example where we're talking about comparable, but not identical. And in some case, and we think that overall the value is certainly as good or better. Next slide, please. more numbers. This is full disclosure of all of the different elements of this program. And here you can see that if you look at the numbers at the bottom, lower right, you can see Kaiser under Cisc is a 4.3% increase. If you stay on your own, direct to Kaiser, you'd get a 4.9% rate increase. Very slightly different, but there is a difference. There you go. So next slide, please. Okay, now we're going to get into managers and PFT to continue making sure that we cover everybody's interests. Here we have the two plans that are offered to managers and PFT. There's a traditional plan and a light plan. The light has no out-of-network benefit. The Cisc plan on the right-hand side is the same plan we've been looking at elsewhere. It's a $10 copay. That matches up pretty well. Here again, no deductible, upper right-hand corner. And the annual out-of-pocket max, $1,000. The ER copay here is $100 versus $35. It's still waived if you're admitted. The pharmacy out-of-pocket is also lower than your current plan, and the brand copay, both retail and mail order, is lower than the enforced plans, but the brand copay is higher. Slide. Lots more numbers. You can see we have in the little tiny numbers in between the columns, we've listed the number of people enrolled by plan. So you can see over there on the far left how many folks we have enrolled in the traditional, and it's less than 50. You can see that in the light plan, it's about 120. And we're showing the way this would work is that if the change is made, that everybody would be enrolled on the far right-hand side in the same Cisc plan. Now, if you look at the lower right corner of the chart, you see some red numbers. In this case, red is good. And it's good because the Cisc combined plan, the Cisc plans for managers and PFT would be $1.8 million less expensive than the in-force arrangement. And if you look at the boxes on the upper right-hand corner, you can see that the rates are lower across the board than all of the existing plans. Next slide, please. So now we're getting into Kaiser for managers and PFT. Want to make sure we cover everyone. So here again, if you look at the red and green, it's the shorthand version of all of this. You can see it's the same emergency room copay, and it's higher with Kaiser, but chiropractic is covered under the Cisc alternative. It's green in the middle of the page and not covered under the enforced plan. You can see that there's also the same slightly different vision plan allowance for hardware. And you can see that the $150 is every 24 months, but contacts are every 12 months. And then lower right, you can see that the pharmacy copays are overall a little bit better, with the brand copay being lower under the Cisc plan than under the Kaiser HMO Direct with the district today. Next slide, please. As you would have expected, this is the kind of rhythm. We show you the benefits, then we show you the price. Here, the benefits are, you know what the benefits are. We've got 337 people enrolled. That's going to go up about 4.9%. For those same 337 folks enrolled on the far right-hand side of the page, you can see that we're looking at a 4.3% increase. Very slightly different. The single rate under Kaiser with Cisc is a little higher, but the two-party rates and the family rates are lower. Slide, please. So what comes along with all this stuff from Cisc? What are the other reasons that Cisc might be a good alternative? Well, first place, there's free flu shots. There are free on-site biometric screening events, gym membership discounts. You can get a second opinion on any surgery, and you go directly to Cisc's provider for this service, which is Teladoc, and they will collect all the records. If you're scheduled, for example, for hip surgery or back surgery, you should know that up to 25% of recommended surgeries are not confirmed by a second opinion, and about a third of surgeries, the diagnosis is different, and also close to a third, a different procedure is done than the one originally recommended. A lot of advantage in getting a second opinion on surgery. Cisc also has its own employee assistance program, which would be available as part of the package. And they have a digital employee assistance program that allows people to get some help from another source than the current district EAP. Next slide, please. For Anthem folks only, there are free generics at Costco. The previous slide was Anthem and Kaiser. So this is Anthem only. There's something called Vida. Vida, you can call in and sign up with a coach for nutrition, for diabetes, for weight management, for mental health. This is a coaching digital therapeutic. You got a phone, you can get to somebody to get some help. There is something called diabetes prevention coaching through an outfit called LARC. Hinge Health provides physical therapy online. You get a coach, they send you a tablet, they have sensors that fit on your body. If you have back pain, you don't have to go someplace for therapy. You can do it at home and get better on your own outside of having to spend a lot of time going to the doctor. And there is also some maternity and support. One of the big interests as millennials move into the workforce and some have postponed pregnancy is having extra support for one-on-one maternity coaching and postpartum support. Next slide, please. Also available to Anthem is a surgery benefit, which will get you to Stanford with the best care you can get at a very attractive rate, and they will even pay for a companion to accompany you so that you can be sure someone's there to help you during the surgery. If you want a second opinion on your cancer diagnosis, there is a Center of Excellence program through Cisc with City of Hope, which gives folks an opportunity to have a second opinion about the current their treatment regime. And then finally, there is a telehealth option called MD Live, where 24/7 you can pick up your phone and talk to a doctor about anything that's going on. And they may, if they can't handle it, they might tell you to go to the ER, but they are able to work with many, many things that may come up. These are all added on to Cisc. These are all Anthem advantages. Next slide, please. Okay, this is 40 minutes, and you guys are being very brave, and I appreciate y'all sticking with me. We're now going to get into retirees. What you saw before, so let's just be really clear. What you saw before was available to all actives and anybody who's not on Medicare and is covered by the district's plans. So Cisc would, and their PPO and their Kaiser plan are going to pick up all the actives and non-Medicare. So everything you've seen before is for folks who are either retired, no Medicare, or still working. Now we're getting into folks who have Medicare coverage. And we're going to talk about an Anthem plan and versus an Anthem Medicare Advantage plan. And we're going to talk about Kaiser Senior Advantage Direct versus the Cisc version of Kaiser Senior Advantage. Next slide, please. Okay, Anthem first. Many of you may have heard of Medicare Advantage. We got a really long title at the upper left-hand corner of the slide. Anthem Medicare Advantage Prescription Drug PPO Plan. Oh my gosh. The reason we have written it that way is that you get one ID card. Everything's in one place. It's not no companion thing. There's not a pharmacy benefit manager involved. It's all run directly through the Anthem Medicare Advantage plan. Benefits in the Medicare Advantage plan, again, are not identical. They are either comparable, and in some cases, they might be a little bit less or a little bit more. We believe that the value is as good or better. Very little or no disruption in provider access, and we will document how that works in a couple slides. And we've added some very high-touch customer service aspect to this program. Key things include concierge services, in other words, dedicated customer service people for Medicare retirees. Value-added programs, we have rates, plan design, disruption analysis, and in the appendix, there's discussions of Medicare Advantage plans in general and ratings from the feds. Next slide, please. So we wanted to make it clear that what is being proposed here is a Medicare Advantage plan that provides a very, very high level personalized customer service aspect. I work with retirees in every jurisdiction that I have worked with for the entire 40 years I've been doing this. And retirees are by far the most vulnerable population. Some of them have caregivers. Some of them are living with a family member. Change, it tends to be hard for some folks. I've worked with programs where we had people over 100, people in their 90s, 80s, 70s. Retirees are as different one from another as anybody else. And some people get it and some people don't. What we wanted to try and do was make it easier for retirees to cope with change in moving to a new delivery system under a Medicare Advantage plan. And we're proposing to do that by having an entity called Retiree First who specializes in this, give us a dedicated client advocacy team, a specific phone number, 24/7 report, and particular attention to folks who have complicated situations going on. Some of the things that are covered are all those bullet things down at the bottom. When you get your copy of the slides, you'll be able to see these in more detail. Prior authorization, ID card replacement, scheduling a wellness check, preventive care stuff. These folks are going to have a dashboard where they're going to call you if you missed an appointment or if you didn't get a checkup you're supposed to get. This is intended to hold the retiree's hands through a difficult process of change and on into the rest of their retirement. Next slide, please. Some of these supplemental benefits for retirees are an easier plan design, claims administration all in one place, a single ID card, gym membership. We're going to take advantage of how much money the federal government is willing to pay for Medicare Advantage plans. And what's underlined there is Anthem has a 4.5 star rating from the feds. That rating comes from people covered by the plan. What the federal government does, the Center for Medicare and Medicaid Services, they survey members covered by Medicare Advantage every year. And if the insurance company providing the benefit gets a high enough rating, they will pay the insurance company more than if they got a low rating. So there's a monetary incentive built into this system to make things better for the participants. In the box on the right-hand side, Silver Sneakers Fitness, some meal benefits, a fitness tracker, and various community support alternatives are value-added benefits to folks who enroll in this plan. Next slide, please. Disruption, can I keep my doctor? Okay, a lot of numbers on this page. The big number, top middle of the page, or excuse, well, the very top. What did we do here? We took actual data for Peralta College retirees showing claims that showed for 2021 that showed that there were claims paid for providers on a list that had some interaction with the health plan. There were 3,773 doctors, hospitals, urgent care, physical therapists, and so forth. 3,700 providers, not employees, 3,700 providers. We were able to confirm by running a match to the provider names that had some interaction with the health plan and Anthem's list of providers who accept Medicare Advantage, that 97%, that's 3,600 of them, have in the past accepted payments from Anthem's Medicare Advantage plan. 2.7%, or 104 of those 3,700 doctors and hospitals, are Medicare providers, but Anthem's never processed a claim for them. So we can't confirm absolutely that they would accept it. There were just 5 out of 3,700 that don't take the Anthem Medicare Advantage PPO. 3 of them are physical therapy, radiology, or optometry. For the 109 of the 3,700 that we either don't have evidence for or don't accept, a paper claim can be submitted to Anthem for 100% reimbursement of charges. So that's pretty close to, that's what we would call no disruption. Next slide, please. So now we're getting into the benefit comparisons again. And for interest in retiree benefits, at the back of the presentation, slides 52 to 59, there is an 8-page, much more granular comparison, line by line, of what's covered and what the benefits are under the 2 plans. The very short highlighted version is on this page. Same thing, same modality, green and red. And from a very high level program, it looks like everything in the Anthem plan is better, and the Medicare Advantage plan is better than the current Anthem plan. That is not the case. We encourage you to look at the line item benefits, because there are some things in addition to these that are better, and there are a few things that are less. So we want you to make sure that you have all the information to make a decision, and we're giving you full transparency on what's being proposed. Next slide, please. The difference in price is substantial. If you look at the little numbers in the middle of the page, far left, we have 380 folks here that we expect to move over. We are looking at rates. The single rate, for example, is $250 less. The rates from Anthem Medicare Advantage are dramatically lower, $1.5 million for 380 people. And the reason for that is mostly that the federal government is willing to make a substantial payment to an insurance company like Anthem, or you've heard of United Healthcare and Humana and others in the Medicare Advantage space, to take the risk for covering folks and then covering Medicare retirees. And then the federal government says that you, the insurance company, we're going to give you close to $1,000 a month, but we're going to regulate how much you can charge to cover the cost that we don't cover of all the services that Medicare is supposed to provide. And what they have is a overview. Each insurance company, Anthem and Humana and United Healthcare, has to submit a proposal to the federal government every year for approval that the rates that they are charging are fair, that the profit margin is regulated and within the guidance of federal government, and that the employee satisfaction is high. That's where the star ratings come in. So this is this is the big reason that the rates are lower. Next slide, please. So let's get to Kaiser. So Kaiser, we're now Medicare retirees still. This is the Cisc flavor of Kaiser. Kaiser is Kaiser. What's different is the benefits are slightly different. Similar, not identical, no difference in provider. And I'm going to show you rates and benefits. Next slide. Same approach. Green is better. Red is not as good. You can see that in this instance, zero copay plan. There's a Kaiser zero copay plan. The current plan has no ER charge. Proposed would be $50. The chiropractic, as with the other benefits, is not covered under your current plan, would be covered with a $10 copay under Cisc. And then vision is the same alternative, $150, slightly less allowance, slightly different frequency, and pharmacy benefits are identical. The rate difference on the zero copay, Kaiser is a little bit cheaper through Cisc, and the rates would be, we have one set of rates for the first 3 months and a slightly different set of rates for the next 12. That's the way we had to get it to work for Kaiser if this is approved. Next slide, please. Here we are comparing the in-force Kaiser $10 and $15 copay, because there is a $15 Kaiser plan offered in force today. And you can see that green and red highlights on the right-hand side. There are no differences until you get down to the ER in the middle of the page, $50 instead of $35. Again, chiropractic 10 versus not covered. Vision 150 versus 175. And here we've got the reason that the $20 is in red is because if you go to the far left-hand side of the page, the current Kaiser $10 copay plan has $15 for brand. And what's being proposed here is a $10 copay plan, but the pharmacy brand copay is a little higher. Full disclosure. Next slide, please. Proposed rates. Same versions here. You can see that it is the Kaiser rates for Medicare are going down a little bit. Either at the bottom, numbers in red, left-hand side of the page, it's 5.6 for the $10 plan and a -6.5 for the $15 plan. The combined savings for the $10 plan that would replace both of those other two is 13.9% or $135,000. Next slide, please. So we then have an appendix that has lots and lots and lots of line by line of everything. And I don't know, we're now at 55 minutes. And I don't know, Dr. McKinley, shall we leave the appendix out? Shall we go into it further? What would you prefer?
I suggest you can cover as much as you can in 5 minutes. We're going to have to stop at
Okay. Okay. Okay, let's go. All right, so there's about 8 pages here and same version, green and red. This will be kind of quick. The first green thing, upper right, this is the Anthem Medicare Advantage plan. There is no lifetime maximum versus 2000. If you look lower right, skilled nursing facility. Is it provided 3 days prior to hospital stay? Your current plan does that. The proposed plan does not do that. Skilled nursing, so there's a waiver. You don't have to have 3 days in the hospital before you get skilled nursing. So it's a better arrangement. No, it's in this case actually better. In terms of duration, there is a difference in how long you have to be discharged between each period of skilled nursing. The current plan is 14 days and the proposed is 60 days. Next slide, please. This is an exhaustive iteration of the outpatient services. Everything on this page matches as you go down the left-hand side. It's surgery, hospital, mental health, both individual and group, day treatment, outpatient rehab, occupational therapy, etc. Down below, Medicare specialist visits, chiropractic, podiatry, eyewear, and so forth. No difference between the enforced and proposed plan. Next slide, please. There are also no differences on these pages. If you look upper left, the first segment is ambulance and emergency room. So ambulance copay, ER copay, etc. There's a non-emergency ER visit for $25. On the right-hand side, you can see that there's no copays. It matches the existing plan. If you go down to the lower left, this is Part B pharmacy, as well as blood transfusions and so forth. The benefits are identical between the current plan and the proposed plan. Here we have a few differences between in durable medical equipment, home health, and transplant. So what we're looking at, upper left-hand side, durable medical equipment, crutches, walkers, that kind of stuff. Prosthetics, that's like pretty obvious. Orthotics, there is no maximum under the proposed plan. Diabetic shoes and inserts, no maximum under proposed. The next three.
You're muted, Tom. Tom?
Okay, sorry about that. Don't know what happened. Can you hear me?
Yes.
Can you hear me?
Yes, we can hear you. We can hear you.
Okay. So this is now yet more talking about different kinds of procedures, upper left-hand side, clinical lab, outpatient x-ray, diagnostic, and so forth, all a match. Preventive services, there is no maximum in the new plan. The current plan, there's $250 maximum per year. We think that's a significant improvement. All the screenings are listed here on this page. They're essentially identical. No slide, please. Next slide, please. Okay, so here again, more preventative. Again, what we highlighted here is that there's no maximum for any of these things in and out of network, whereas there is a calendar year maximum under the existing plan. We think this is a significant improvement. Next slide, please. Okay, here's where we have some pluses and minuses going on, and it's important to look at these. In terms of fitness, silver sneakers would be added. In terms of podiatry, the current plan, there's no limit. The proposed plan would have 12 visits. Acupuncture, now it is no copay for routine acupuncture visits. For acupuncture, there is a 30 visit limit per year combined with chiropractic versus no limit right now. Same thing on chiropractic. It's 30 visits combined between acupuncture and chiropractic. Routine eye exam is now not covered. It would be covered. Vision, there's not covered now. It would be covered at $100 combined materials. Hearing aids, a $500 allowance. A hearing aid, that's $500 every 12 months. Private duty nursing, today there's no limit. Proposed is $10,000 maximum per year. Next slide, please. Okay, this is talk about geeky. Sorry about all the geek factor here. There are so many weird terms that you see in the right-hand column over there, the proposed plan. What we are trying to say, even with all those crazy acronyms, is that the coverage is as good or better under the proposed Anthem plan as it is under the current Anthem Coordination of Benefits plan. What they mean by Part D gap coverage, if you get over around $3,500 a year in Medicare drug benefits, there's the old donut hole, which started back with George Bush II administration. And I'm not going to get into all the geek stuff. You have questions about it, we can answer it. But what we're trying to say is that this is comparable or as good or better coverage. Next slide, please.
Tom, we've run out of time now. So, folks, what we'll do, we will send copies of the slides to everyone, and using all Peralta. And these slides will also be posted along with this recorded presentation. So you'll be able to see everything that's here. And of course, we'll be available to help answer any additional questions. The questions we were not able to answer in the Q&A, we will post the answers to those questions for you in the next few days so that everyone gets their questions answered. Turn it back over to you, Mark, to wrap it up.
Great. Thank you very much, VC McKinley. Thank you, Tom, and the Alliant team. And with that, we will end the meeting. Have a good day. Thanks very much. Bye-bye.